Hi there, this is Dr. Stuart Yoss from Bannockburn Chiropractic and Physical Therapy. Today we're going to talk about how we treat carpal tunnel syndrome in our office. Last week we mentioned some of the causes, some of the testing and the evaluation to determine if it's carpal tunnel syndrome. Now we're going to do what happens if you actually have it and how we're going to help get you better. Today we're going to talk about and show you different ways that we do it in our office. Next week we're going to show you things that you can do at home on your own to help treat it and help supplement what we do in our office. So the first thing that we do in our office is we're going to do what's called a chiropractic adjustment. And we can do that to several areas. The first area and most important area for this is going to be of the wrist. So what we do is just going to take the wrist and give a quick little thrust and an adjustment. There's 8 bones in the wrist, 8 carpal bones, and we can adjust all 8 of them if need be. Typically there's 2 that are most important, but we can adjust any of the wrist bones. The second component is we're going to start working with some of the soft tissue doing active release technique, or ART, something that we specialize in our office. So with ART, what we do is we take the muscle from a shortened state to an elongated state. So one of the muscles that we're going to incorporate is the wrist flexors. Those are one of the tendons that gets caught underneath in the carpal tunnel. So what we're going to do is we're going to have her flex her fingers, flex her wrist, bend her elbow, and then I'm going to have Kirsten straighten her elbow, extend her wrist, and extend her fingers. And I'm creating a tension in this muscle to pull the muscle lengthwise while I'm creating a tension up her arm to break down any scar tissue or adhesions that may be occurring in that wrist. So that's one component of ART that we're going to do. Okay, so the second component of ART is we're going to work with the nerve and work the entire tract of the nerve, the median nerve that is. So how we're going to do that is we're going to shorten the nerve up. So we're going to tuck her thumb, tuck her fingers. We're going to bend her wrist. And now we're going to straighten her arm out, bend her head that way. And I'm going to tension this way. And now I'm going to have Kirsten bend her head to the right. We're going to bring her arm all the way down. She's going to bend her elbow. Now she's going to extend her wrist, open her hand as I create a tension. And what that's doing is pulling the nerve this way while my tension is going that way to get the nerve to be able to glide through the area in the pronator teres, which is a common area where we see entrapment of the median nerve with carpal tunnel syndrome. Now we're going to tension this way, and she's going to tuck her thumb, curl the fingers, bend the wrist, bring an arm, bring it out here. We can also do the same thing down here at the carpal tunnel and get everything to slide this way as I create a tension that way. So we're going to kind of do ART in multiple areas up the arm and even up at the neck if we need to make sure we can get the nerve gliding entirely up and down the entire path. Okay, a third treatment that we incorporate with for carpal tunnel syndrome is using something called cold laser. So what we do is we use this head, and as we turn the machine on, what it does is sends light energy down to the tissue, actually all the way down to the cellular level, and it's going to increase nitrous oxide and all these different byproducts that are going to decrease inflammation and promote healing. So that's another technique or modality that we use in our office to help reduce the inflammation that's going to cause the entrapment of that median nerve at the carpal tunnel. One more treatment that we incorporate for carpal tunnel syndrome is dry needling or acupuncture. So you can see how multi-talented I am that I can actually get acupuncture done to me and talk at the same time. So there's certain key parts that we use for carpal tunnel syndrome, certain acupuncture points. As you're seeing Dr. Winters applying to me, you can see it doesn't hurt. I'm not even wincing. And this is quite effective for carpal tunnel, and it works really well. So not painful, super easy. Just boom, just little needles in the arm, and that's it. Okay? So that's another modality that we use to help carpal tunnel syndrome here at Bannockburn Chiropractic and Physical Therapy. Again, any questions, feel free to reach out to us and give us a call.